Introduction. Skin diseases are a common problem that can affect people of all ages. Atopy and general skin diseases are two different conditions that can cause various symptoms on the skin. Atopy is a genetic predisposition to develop allergic reactions to certain environmental triggers, while general skin diseases can have a variety of causes. This report will provide detailed information about atopy, its causes, symptoms, and management strategies. Causes of atopy. Atopy is caused by a combination of genetic and environmental factors. Individuals with a family history of atopic conditions such as eczema, asthma, or allergic rhinitis are more likely to develop atopic dermatitis. Environmental factors such as exposure to certain allergens like pollen, dust, or animal dander can trigger or worsen atopic dermatitis symptoms. Symptoms of atopy. Atopic dermatitis is the most common manifestation of atopy, and it can cause a variety of symptoms. These can include red, dry, itchy, and scaly patches of skin, particularly in the folds of the skin such as the elbows and knees. Scratching can worsen the symptoms and cause skin thickening and discoloration. In severe cases, atopic dermatitis can cause open sores, weeping, and infection. Management of atopy. There is currently no cure for atopy, but various management strategies can help alleviate the symptoms and prevent flare-ups. These strategies may include 1. Diet management. Certain foods like eggs, peanuts, soy, and wheat can trigger or worsen atopic dermatitis symptoms. Identifying and avoiding these trigger foods can help manage the symptoms. A balanced diet that includes fruits, vegetables, lean proteins, and healthy fats can also help support the immune system and reduce inflammation. 2. Prescription drugs. Topical or oral medications such as corticosteroids, antihistamines, and immunosuppressants can help reduce inflammation, relieve itching, and prevent infections. It is important to use these medications as directed by a healthcare provider to avoid side effects. 3. Hygiene management. Maintaining good hygiene practices can help prevent infection and irritation. This includes bathing with mild, fragrance-free soaps, avoiding hot water, and using moisturizers to prevent skin dryness. Avoiding scratching and keeping nails short can also help prevent skin damage and infection. 4. Environmental management. Avoiding exposure to allergens such as pollen, pet dander, and dust can help prevent flare-ups. Using hypoallergenic bedding and vacuuming carpets regularly can also help reduce exposure to allergens. It is important to maintain a comfortable temperature and humidity level in the home to prevent skin dryness and irritation. Conclusion. Atopy is a genetic predisposition to develop allergic reactions that can manifest as skin symptoms, primarily atopic dermatitis. Management strategies can help alleviate the symptoms and prevent flare-ups, including diet management, prescription drugs, hygiene management, and environmental management. People with atopy should work closely with their healthcare provider to develop a management plan that meets their specific needs. By following these strategies, individuals with atopy can reduce the frequency and severity of their symptoms, leading to a better quality of life. Subscribing and liking the video are a great help. Thanks for watching.